Hi there, Brewskers. How we all doing? Well, I have a different story to tell today. It's not about mental health, but it kind of deals with it. Kinda. But here's the story I'm going to tell you about what happened on February 20th through the 21st. I hope you enjoy. So it started February 20th, 2021. I was at Walmart shopping with my caregiver. All of a sudden, while walking, I about collapsed because I felt a pop in my abdominal area. And I knew I had some cysts there, so I figured it was just that. But when I got home, I felt another pop, and it was on the other side of where I felt the first one. I knew there was a cyst there as well. I figured, okay, I've dealt with these cysts before. They're not painful after a few days. Well, here's what happened on the 21st. On the 21st of February 2021, I went to the hospital because the pain did not get any better. It got worse and worse and worse. So I went to the hospital in an ambulance because I could not even find a ride, and I was in too much pain to even ride the bus. So I got an ambulance and I was taken to the hospital. And, the ambulance people were very nice. They were trying to get my mind off the pain. And, it's only like a 2-mile ride, honestly, so it wasn't that bad of a ride, but it all went downhill once I got into the hospital. Once I got into the hospital, they ask all the usual questions, especially the COVID questions. Did you be around anyone that had COVID? Do you feel like you got COVID? Blah, 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 blah. Whatever. The COVID thing's out of the way. But when the doctor finally came to see me, he asked all the questions, and then he pushed around on my abdomen, and I told him where it hurt the most, which was right near my pelvis, maybe just a little higher. And he was pushing, and I just wanted to punch him in the face, like, stop, dude, it hurts. And so he said, okay, we'll get some tests. And I asked nicely, can I pretty please get something for the pain? I can't deal with this anymore. And he looked at me, rolled his eyes, and said, yeah. Here's what happened next. A few minutes later, a nurse brought in the meds that she said were going to help me. But she put them down, and she realized she didn't have what she needed to put it into my IV. So when she left, I read the vials. I don't exactly remember what they were. I know one of them was Benadryl and another one was Ativan. And I could tell the other one was probably Haldol. But the nurse said, oh, don't worry, we're giving you some, what's it called? Tramadol. And none of those vials said Tramadol, and there was only 3, and like some saline syringes. She just needed to go get the thing to stick the IV into my arm. And I asked her, oh, what are these for? What are these? And she's like, oh, these will just help the Tramadol get into your system. And I'm like, okay. And so she injected it, and then I realized she just injected me with sedatives, something to knock me out. And honestly, I wish that happened like last night, because I needed sleep, and I haven't slept in a long time. Anyways, that's a different story. But, I asked the doctor when he came back before I had to go do the other tests. I mean, they did the usual blood test, pull out all the blood like a goddamn fucking mosquito. And then went off. And then the doctor came in and said exactly what tests they're running, and he said a CT scan. I asked nicely, can we also get an ultrasound? He did not. He denied it. And he said, don't worry, the CT scan will show everything. And I was like, okay, but just to let you know, I had a hysterectomy. I don't know why you're doing something like that when I know what it is. I told him exactly what it was. It was that a month before they found 2 cysts, one on my left and one on my right where I had my ovaries. And I had a hysterectomy at age 24. I'm 32 now, so it's been a while. And you know, I told him I had cancer, and I remember the doctors that took the last ultrasound and CT scan, they said that there's 2 cysts, one on each side. And I know they popped. I know they popped because it felt exactly like all my ovarian cysts that popped. And he's like, no, don't worry. You got medicine. You'll be fine. And I was like, no, these are sedatives. Please give me something else. And he said, no, you're fine. You're fine. And that's when I realized, oh shit, he looked at my chart. He saw that I have schizoaffective disorder. He thinks it's all in my head. And he did say that before he discharged me. It's all in your head, don't worry about it. And anyway, the CT scan showed nothing. No cysts, no nothing, no ovaries, no uterus, nothing. And the only thing it showed was mild constipation, which I don't know what the heck that's about because I'm going to the bathroom just fine. Anyways, so he discharged me. He said, you know, oh, don't worry, it's just your intestines spasming because you have to go to the bathroom. And I was like, no, I know the difference between a spasm and a pop, you know, and I'm pretty sure you didn't need to give me sedatives. I'm being as polite as possible. Now, if I was yelling and screaming and throwing a fit, yeah, give me sedatives. But no, he denied any medication. All he gave me was something for the muscle spasms in my intestines and sent me on my way. And I was like, okay, maybe it is muscle spasms. So I took the medication for a day, and it did nothing for my pain. And honestly, it made my constipation worse. And yeah. So fast forward to today, I've been dealing with the pain for about 6 days now. 6 days of non-stop pain. And I'm at the point where I decided to go on my chart where I could check all the test results, because he didn't tell me about my blood test results. He just told the CT scan. So I read the CT scan results and I read the blood test results. It turns out I have an infection somewhere, and he didn't think about telling me at all. And I was very upset about this. I'm like, where's the infection? Like, I didn't have an infection last month. Where's the infection now? So today I see my doctor around 3, and we'll see about what we can do, because it still hurts like a lot. It's really hard to walk. It hurts to lay down. I have to literally sleep in this chair. Like, I can't. It's just, it hurts too much. Like, I don't want to do anything. I just want to lay here. Though I know getting up and moving helps. I know that, because that's what every person has every doctor, every therapist, everyone has said. The more you move, the less it hurts. Though I find that a lie, because it hurts even more as I move. And the fact that I am in so much pain and resorting to kratom use just to not feel the pain and make it through my day. I mean, I don't take it that often. I try to skip every other day, because, you know, I don't want to get addicted on it again. I just want the pain relief, and it seems to last about a good 48 hours, it seems. So I don't hurt too much today because I took it 2 days ago, but it still hurts. Like it's kind of bearable, but not really. Like I just want to curl up in a ball and cry, honestly. And at this point, I refuse to go back to that hospital. I decided, well, since they decided to treat me like I really had nothing wrong, if I was to be dying, I'll just stay here in my apartment and die where I'm comfortable and not in an uncomfortable gurney waiting for a doctor to get his head out of his ass and actually do something. So, but after I got home on the 21st, I was scrolling through TikTok. I found a video of a doctor explaining why women are treated differently in the ER. I will attach this TikTok video at the end of this video. For women out there who go in, you need to advocate for yourself. You need someone to come in with you. You need someone that sees you in pain and to be like, no, she's not psychotic. She doesn't need sedatives. Okay, so women, if you can, go to the hospital for pain and they treat you as if you're just having a panic attack, or you're just, it's all in your head. Make sure you fight for yourself. You tell a doctor, why, on record, why are you not giving me this treatment that I'm asking for? Why are you refusing medicine? And why are you refusing to do this 1 or 2 tests that I am asking for? And if he does, put on record that he just doesn't think you need it, and it just goes downhill, it could really screw his practice up. He can lose his job and lose his license. So, well, this is near the end. I will attach the TikTok video that I found on TikTok, and I hope it gives you some answers if you're a woman. I really hope that it teaches even the males something. So, fight. I may not have been able to do it because I was so sedated, but the next time I go in, if I go in, I would have to be absolutely dying to go into a hospital. And a sad thing is there's only one hospital near me. I had no choice to go to this hospital because they won't take me to the one in Vancouver, which is like 30 to 45 minutes away, and the ambulances just won't take me there. So I have to go to the one hospital that is near me, and it sucks. Well, this is the end. Tell me what you think about the video of the TikTok video. If you're a woman or a man, tell me what you think. Like, subscribe. I usually talk about mental health, but this time I figured just a small touch on physical health. If you're in pain, fight for it. Be like, I need it. I understand that you think that I might be a junkie, but you should at least do some tests. Because that's all they think about here. They just think I'm a junkie. And that's sad. I'd rather not take the pain meds. I'd rather, if I could, I'd be off of my psych meds, but I can't do that. Tangent after tangent. But here's the end. Enjoy the video from TikTok. Tell me what you think. Like, subscribe, share if you think it's important enough. See you around.
Hi, I'm Natalie, and according to modern medicine, I'm 6 times stronger than my husband.
Looks like it's time to put my white coat on again. White coat's on, so let's answer the question. Are women stronger than men when it comes to pain? Here are the facts. Studies have shown that when women go to the emergency room in severe pain, they are less likely to receive narcotics for that pain compared to men. Most of the time, their symptoms are brushed off as psych issues or anxiety, so they're given sedatives, which does nothing for the pain. If they are given pain medicine, they have to wait longer compared to men, 65 minutes on average versus 49 minutes on average. And if they present to the emergency room with chest pain, they're 7 times more likely to be misdiagnosed when they're actually having a heart attack. So yes, Natalie, women are stronger than men, but only because we have to carry the bullshit of patriarchy, sexism, and misogyny that's present in medicine and has been for a long time.